Hello, hello, hello. Looking at it this way. Hello, good afternoon, guys. This is Dr. Barry, board certified internist, founder at drpiersblog.com, author, speaker. Bringing you another edition of the weekly wrap up. I'm going to give, like always, going to give you guys a couple minutes to get on. Then we're going to go ahead and get this thing started. So I'll give you guys a couple minutes while we get things set up, share it away. If you do join, go ahead and press the like button like always, but most importantly, share in that regard. So give you guys a couple minutes, then we'll get this thing right started. Apologize for coming on a little late. Patience ran a little bit late as always, but that's okay. That's primary care office. That's what we tend to do. So give you guys a couple seconds, then we'll get ready. All right. I'm actually gonna go ahead and share on my personal page. And I'm thinking probably my next lunch and learn, I just want to see what the numbers are going to look like. I'm probably going to broadcast from my personal page and then share it to my personal, my business, my Dr. Barry page to see if we notice a difference. All right, we are shared away. We have a few people keeping an eye on us. We're happy about that. All right. So now let's get started again. Just to start off again, Dr. Barry, board certified internist, founder at drpiersblog.com. Today we are talking about heart failure. Why are we talking about heart failure? Because we just had, unfortunately, another celebrity passed away in the year 2016. It seems like we can't go a couple of weeks without somebody passing away. But George Michael, famous pop star. I'll be honest, I didn't really listen to him very much, but had friends and family who did. So, and I did notice a few. I knew a few of his songs. I just didn't know who was the actual person doing the song. But unfortunately, he passed away due to complications of heart failure. So I definitely wanted to jump on here and give almost like an introduction on heart failure. I didn't want to go full nitty gritty. I actually have a good friend of mine, Dr. Mike, cardiologist, who's actually going to be doing a talk later this week. I will share on our business page and he's going to go much more in depth on heart failure than I will. But I definitely wanted to give you the internal medicine prospect of it. From a clinical aspect of it, heart failure is something that I deal with a lot. It is something that most good general internists are managing in their primary care setting, but there are cases where we need our cardiology friends to get involved. So definitely something that I am very familiar with, as well as my cardiologist. But like I said, he's definitely going to go into much more detail. I believe he broadcasts on Fridays. And so when he does, I'll definitely make sure we share that page and get you as much of an in-depth view on heart failure as we can. Rashir, how you doing? Appreciate the view. Go ahead and share, like always, much appreciated. So let's talk about heart failure in general. Again, we're going to be in very layman's terms. Not going to be not a lot of clinical terms here because we're not going to put too much on you guys. But when you think about the heart, the main job of the heart is to pretty much pump blood throughout our body. Well, just from a plumbing standpoint, that's its number one job. So when we talk about heart failure, think of it in terms of the plumbing aspect of it, where your plumber, that heart, fails. And it fails for a variety of reasons. We'll go a little bit over the variety of reasons, but it fails getting enough blood circulation throughout the heart. So what does that mean? What's the problem? What occurs in that regards? For our patients who have heart failure, who suffer from heart failure, lots of different reasons. Blood pressure me being internal medicine, something I'm very interested in. Blood pressure control and the lack of it is a very common cause of patients going into heart failure. A lot of endocrine type issues in terms of thyroid disease, anemia, in terms of coronary artery disease, just in general, plain old heart disease in general could put patients into what we consider heart failure. Again, kind of going back and what we talked about, heart failure is the heart's lack of ability to get blood flow throughout the rest of the body. And when that occurs, problems arise in that regards. So when we talk about heart failure, there is, again, lots of different reasons. Again, I'll just read off a few of them just to, because, there's actually lots, but I just want to read off a couple. Thyroid issues we talked about. People who are suffering from kidney problems can have concerns for dealing with heart failure. Abnormal heart rhythms, including like palpitations, including irregular rhythms like atrial fibrillation, a very popular abnormal heart rhythm that can cause heart failure. Patients who suffer from a heart attack can go into heart failure as well. Because again, remember, just in the plainest terms, heart failure is my heart can't get blood throughout the rest of my body. So these are some things that can really affect the heart in a very quick and acute way in that regards. And a big thing from a substance abuse standpoint, alcohol, and I unfortunately see it a lot in the hospital setting. But we do see it as well in the office too when they're stable. Like excess alcohol can put patients in heart failure, or can eventually put you patients in a chronic disease of heart failure. In our case, especially with George Michael, he likely suffered from an acute case of heart failure. We're not sure due to what, they didn't say. But there's lots of reasons why you can acutely go into heart failure and cause problems. My guess is likely going to be some type of heart-related disease, some type of coronary artery disease, some type of abnormal rhythm that put him in heart failure and then cause problems later on in that regards. I think from a signs and symptoms standpoint, because this is what's going to be most important for you guys. A lot of my younger followers, you're not going to have any issues with heart failure. But now I'm talking about what to look for in mom, dad, and especially grandma, and grandpa. Those are the ones who we really want to keep an eye on. Weight gain is probably the biggest one, because if you're retaining fluid, and your heart can't deal with all of the excess fluid that you're retaining, you can go into heart failure. And well, I kind of hinted at it last week on Last Lunch and Learn when I said, I know the holidays are coming, and I know you guys aren't going to be eating like you should, especially, and I was talking specifically to my heart failure patients, and that's the reason why. Because I have some patients who suffer from heart failure that they can't even have a bag of chips. Like one bag of chips puts them in a heart failure. One bag of chips puts them to the point where we call fluid overload. So it's definitely something that from a dietary standpoint and salt intake standpoint, we keep a very close eye on. And when we talk about heart failure, there's a couple sides, again, from just a layman's terms. You guys don't need to know right side versus left sided. It's great if you did, but you guys don't need to know right side versus left sided. That's more for the medical realm of things. But in terms of when we talk about heart failure, you can have swelling. You can have swelling in the legs, but not only can you have swelling in the legs, you can have swelling in the veins in the neck. You can have your belly starts to swell as well. So you can just start swelling everywhere because of heart failure. Because again, your heart cannot get rid of that excess fluid. Shortness of breath, very common complaint we get around this time, especially when people aren't really adequately doing what they're supposed to do on their diet concern. Hi Amanda, how you doing? Oh hey Mark, how's it going? Appreciate the views, much appreciate stopping by. We can get wheezing as well. Dr. Denise, hey, how you doing this afternoon? Thank you for joining today's Lunch and Learn. Shortness of breath, wheezing. Some people even get, especially my older patients, they can't even lay down without getting short of breath, because a lot of that fluid, again, their heart kind of just sits in the lungs, and that's when they get short of breath. So again, shortness of breath is a big one. Swelling is a big one as well. If you start getting that, your neck veins almost feel like they're popping out, that's a big one as well. For something to be concerned about when we're dealing with heart failure in general. And there's a lot of ways that we try to prevent it, especially me, the internal medicine standpoint. One, controlling blood pressure. making sure your heart rate is where it's supposed to be. But when we start talking about the very clinical diagnostic aspects of it, I am going to leave that to my friend Dr. Mike, the cardiologist, who should be broadcasting on, I believe, Friday evening or afternoon. I'm not sure what time he broadcasts. He'll go much more in detail and depth as far as heart failure is concerned. I just wanted to make sure I gave you guys the internal medicine aspect of it, because again, it is something that if all of our heart failure patients had to see cardiologists, those cardiologists would never get anything done. So we definitely are a team effort in getting you guys treated. And again, when I say you guys, I'm not talking to my young folks who are watching. I'm talking to grandma, grandpa, mom, and dad, those who've been suffering from blood pressure issues, those who've been suffering from irregular heart issues, diabetes, lupus is another big one as well that we always have to be very careful when we're dealing with the heart. Because remember, our heart is our big plumbing machine. And once that gets backed up, it can't go nowhere else. Once your heart gets backed up, where is it going to go? It's going to go to your lungs. It's going to go to your belly. It's going to go to your arms. It's going to go to your legs. The fluid has to go somewhere. So that's why we have to be very keen on what we're eating, how we're eating it, keeping an eye on our weight. And if any of you parents or relatives are suffering from heart failure, that they're almost on like a zero salt intake diet whatsoever, because they don't want no parts of it, because they know it does not take very much for them to go to the other side and end up needing to be in a hospital or needing to get medications to get rid of that excess fluid from that standpoint. So again, thank you guys for staying with me and following along with heart failure. Again, I didn't want to go into too much detail, because again, it is a lot. And we're not gonna brush it off like you can just kind of read one page and kind of be about it. I just went over like the main issues. I'm gonna let my cardiologist, Dr. Mike, really hit it home. Again, I think this Friday, I'm gonna let him hit him home this Friday as far as heart failure and what we have to do, and some signs and some tests and some treatment. Again, I'm not gonna do all that. We'll let our cardiologist friends get that involved. But I did promise a surprise gift for guys who've been watching. Again, for those who've been following, I've just completed my affirmations 2016, and we talked about one of them being I'm about to write a book. So I wanted to let you guys be the first ones to know I'm actually releasing an audio course version of one of the chapters in my my book, How to Be the Perfect Patient. I'm gonna put the link in the comment section. In fact, hold on, give me a second. I can do that right now. I put a link in the comment section that you can go ahead, download my audio course right now. Again, it's gonna be one of the chapters in my book, How to Be the Perfect Patient, which I'm hoping to drop probably around March, April time frame, just depending on everything. Oh, hi, Dr. Tamika. This is America's pediatrician. Please follow her. Follow my two doctors who just got on, Dr. Tamika, Dr. Lenice as well. Great physicians that are definitely helping me get to where I need to get to from that standpoint there. But again, free audio course, drpierce.com/5 survival tips. Much appreciated. Go ahead and join the list if you have not already joined the list. Again, that audio course is free, and you guys will get it directly. And if enough people request it, I can do like a PDF version as well. But definitely want to at least get you something that you guys can listen to. You guys don't have to sit there and read for 10-20 minutes. You can listen to on the ride home, on the way here. And again, just 5 survival tips on how to manage your doctor's appointment. And it's for everybody, young, old, mom, dad, grandma, grandpa. Everyone can benefit from that. You guys have a great, blessed day. Thank you for watching today's Lunch and Learn. We'll be back on Thursday. I'm not sure what topic we'll be talking about. I'm not sure what topic we're going to be talking about. We'll decide something when we get there. You guys have a great and blessed day. Bye.